The introduction of free healthcare by the government of Sierra Leone in April 2010 was a gigantic leap in the reproductive health in the country. Although the initiative was aimed at increasing access to medical services for pregnant women, children under 5 and lactating mothers, the drug supply chain had a lot of anomalies.
Initially, when we started the distribution process, there are a lot of challenges. What I mean is that there are a lot of discrepancies initially when it started in terms of when products were loaded here at the central medical stores and when it was delivered to the district medical stores, and also from district medical store to the peripheral health units.
Securing reproductive health commodities was one of the key challenges. The UNFPA, in supporting the free healthcare initiative, partnered with civil society to enable transparent monitoring and advocacy for the provision of family planning.
UNFPA partnered with civil society, specifically Health for All Coalition, as a formal implementing partner to support advocacy and monitoring of reproductive health commodity security and the provision of family planning services. And so, through civil society, it is proved that they are very critical in terms of monitoring distribution, because our civil society monitors distribution of drugs right from the port to the central medical store to the district medical stores up to the end user and the PHUs.
Health for All Coalition have established a very strong relationship and partnership with the UNFPA. We are doing this through their support to Health for All Coalition in order to be able to train monitors, civil society, community monitors, to look at the inflow and outflow of reproductive health commodities, family planning commodities generally in the country, and also conduct youth-led education on their awareness and importance of the practice of family planning.
We were challenged by His Excellency the President to be able to come out with a distribution strategy that will ensure that every single drug gets to the end user. And so we worked very closely with the civil society to be able to develop the distribution matrix. And we gave them specific role to work with us to ensure and monitor the distribution. And not only that, they actually were given an access to make independent evaluation, and their reports are actually accepted by us and distributed by us, and through that we're able to see where the weaknesses are. So they have worked with us very closely in the distribution as well as handling the monitoring aspects for it, because they have more human resource than we do. And secondly, they can also make independent evaluation. So they have worked with us very well, and we have really and truly appreciated their input to ensure that they monitor our facility, they monitor the performance of our staff, they monitor the distribution of drugs.
The success of monitoring of reproductive health commodities by Health for All Coalition has increased the access to health facilities in the country.
Because right now, free medical don't come, they can hospital, they can born. Then they give free waiting set them, tablets them for picking them. When they sit down again now still they wait till picking body don't white. Immediately where they see picking body don't warm, you take a face and can get medicine.
The flow of drugs has improved.
The way they work with the Health for All Coalition, then they help you now let the medicine they can to time because waiting not to them with the report. If the medicine short when they come, we say this not there, and they are immediately.
Accountability in the management and use of drugs has increased from 50% in 2010 to 93% in 2011. Channel is a monitoring software that enables transparent and accurate drug distribution.
UNFPA introduced the channel system The channel system captures information in terms of, we have a channel system in all the districts, starting from Central America stores here. We have a channel system based here. All products which are all consignment which are received at the Central America are inputted into the channel system. And once they are inputted, all supplies, regardless of from where it comes from, as long as it's Central America stores, also comes through from the channel system, because it's what we call the picking list. That is what it is used to do distribution to the district medical stores or to the hospitals.
The UNFPA engineered software helps to track the consumption of drugs and the returns through the request, report, and issue voucher.
There is an RRIV provided by the Ministry of Health, which is the report, request, and issue voucher. It has a series of drugs names. It has the opening balance, the quantity received, losses or adjustments, quantity dispensed, the closing balance, and the estimated consumption. Then also at the PHU's level, there is daily consumption register, which they use to enter, to fill in the RRIV. So through the RRIV, for the first of any new month, there is an in-charge meetings for all in-charges. So on the day for the meeting, they will come with the RRIV. Then upon submitting it, I will enter directly into the channel, because there's a space provided, there's an RRIV menu provided on the channel software to track the consumption.
With the reduction of anomalies in the drug supply chain, Health for All Coalition has succeeded in advocating for budget allocation for reproductive health commodities for the first time.
For the first time, Sierra Leone was among a few countries in the sub-Saharan Africa that never allocated a budget line to the procurement of the reproductive health commodities. Through the intervention of Health for All Coalition, a budget line have now been allocated to the Ministry of Health and Sanitation for the procurement of reproductive health commodities.
Last year, they put in their work plan that their indicator was to ensure that the Ministry of Health would put an allocation, a budget for reproductive health commodity security and family planning. And they worked with the Ministry of Health right through the process of budgeting and planning for the ministry. And for the first time ever, ministry was able to put some budget or some money allocation for reproductive health commodity security. So we find them very useful.
Complementing the free health care, Health for All Coalition is advocating for increased uptake and intake of family planning. Community advocacy groups have been set up to disseminate family planning messages in their communities.
Family planning hindami akpekpegowa adamiva ba epebo hindu tanya himbiva because apelo dogboto leleji awa ahiamu mujisia a munda hejisia awela ogboyo ho ena be family planning mo abedrile afofele ile fo sawa ile pebi akuye pekembo.
To reverberate the essence of family planning, Health for All Coalition organized a one-day stakeholders meeting advocating the repositioning of family planning as a flagship project in Sierra Leone.
We actually wanted government not to only to prioritize and consider family planning as one key development agenda in their development plans. That is why we are saying we are repositioning, or we want it as a flagship project, because we want government investment in family planning. We want government to invest resources. We want government to redouble its commitment. We want to see government, as well as the Ministry of Health and Sanitation, leading family planning issues in this country, as well as galvanizing other donors' investment into family planning issues in Sierra Leone. So,
if we are to achieve the MDGs, all the 8 MDGs, for them to have an impact, we need family planning to be stepped up globally and in Sierra Leone.
You cannot introduce family planning issues if you don't bring the men on board. So we are engaging the broader community, but we are also making sure that the facilities at the community level has access to these commodities, to be able to make sure that once a woman goes to give birth to a facility, she will do a one-stop shop So the facility that delivers the baby can be able to provide family planning. The nurse that actually delivers the baby is also being trained into family planning units. So we've developed various strategies to make sure we reposition family planning into our health facility in the communities and into our health sector service delivery.